afternoon. Did everybody get their candy? Okay. We grabbed those for, it's still making its way through the system, but I promise it'll get there. I know this is the last session of the day. It's been a long day, but it's been an awesome day. So we're so excited to be here. I'm Alex Miller. I am the, come on in. The Deputy Director for Multi-System Operations at Georgetown University Center for Juvenile Justice Reform.
Hi everybody, I'm Victoria Chamberlin. I am a program manager at the Center for Juvenile Justice Reform in Georgetown. Thank you all for coming to the session today. I know it's the end of the day. It's been a long day, but we really appreciate all of you being here with us.
Yeah.
All right, so today we're hoping that our conversation is a little bit interactive. So what we're going to share with you today is about a toolkit, which is really an information gathering kind of thing that we went through at the university to learn more about what's happening within rural communities as it relates to their juvenile justice system and the services that are provided. And so we really want this conversation to be interactive because, well, first of all, I want to know where you all are all from. And we want to hear from your experiences in rural communities that you may be from or that you may have lived in terms of what are those challenges that you all have faced and what are some of those creative options or opportunities that you all have created or have seen created. So end of the day, we've got our folks. We're also relying on you. So we want to hear from you. So where are you from? Other than Nebraska. Yeah.
Darn, I stole my answer.
Beat you to it.
I was going to say my mom, but.
So, sorry.
Dundee County.
Okay, so I will be very transparent here. This is our first time to your beautiful state.
Yep.
We do not have the geography down packed, so when you tell me your county, tell me what part of the state you're from and just kind of generally describe it. Is it, do you have, is it part of the city? Are you in Omaha? Is it, are you from Lincoln? Are you?
Nebraska, Kansas, Colorado corner.
Okay.
60 miles from Walmart.
Yep.
Our county population is about 2,000.
Okay.
Very rural. No services for 5 counties around us.
Oh, wow.
Yeah.
I'm from West County on the west slope of Colorado. There were 200 kids in my entire high school, and to get anywhere we had to go down mountain and then go anywhere, and there were not a lot of services.
Anybody else?
Well, Northeast Nebraska on the Winnebago Omaha Indian Reservation.
Okay.
So we do have reservations.
Yes. Yes.
So services are scarce. That's why I'm here. And I work in a school, and it's hard keeping consistency in the school. This is my 5th set of principals I'm going through.
Oh, wow.
And it makes it tough to, especially when they're young. And state statutes, those you like to read boring reading, is probably one of the most significant factors in attendance in the state.
Okay.
That started. So keeping up with that stuff really is important for people that don't understand what the states are saying. So it's a challenge.
So that sounds like it's top down too, from principals. Is it all the way down through teachers and counselors? and
Well,
everybody?
yeah, especially when you're in a reservation school and the economics are low.
Yeah.
Not many people can live there, and you're not gonna take roots there, so it's kind of a stepping stone. Because in poverty schools, if you go to teach there for 5 years, they're gonna forgive you your student loan. So it's a stepping stone. So we also have some people that fell in love with us and retired.
So we're a service provider, and we're located in Ashe County, Nebraska. But we have 24 families in northeast and north central Nebraska. So we're rainy strong, so we have a large geographical area that we cover, which is a barrier. Making sure that we've got mediators that are located to help support those services. And underutilized services as well, when we are available to support programs.
So why do you say that? Unutilized?
Well, we don't get a lot of referrals. I mean, Brady's getting us.
We're gonna get along.
It's gonna take all of our time up, so we don't. There are some counties where we haven't had referrals covering in years.
I'm hearing a lot of things that we're gonna be touching upon. And I will say that you all are the experts here. I really wanna make that clear. You live in rural communities or you work in rural communities, and so as much as we are gonna be providing information to you, we're looking for you all to provide information to us. Let us know if you've used the strategies that we're gonna go through, and if they worked or if they didn't. And what other strategies that you've done, or what resources you'd like to see, because Victoria and I are gonna continue having this conversation. We wanna elevate rural communities, and we wanna make sure that we're getting the word out about what resources exist to do that. So we're really depending on you all for us to continue doing this.
Yeah, I think that's a great point. We are the conveyors of information that we have collected. And we'll kind of go through a little bit about how we collected that information and from whom, but like Alex said, you all are the experts.
So I'm gonna jump in here real quick,
Yeah,
because,
please do.
have you seen out there where, like, I'm saying in the state, like, if we could have resources like from the city come up to our community once a month, twice a month, to provide some things that's paid for by the state, you know, since we don't have that. Have you seen that out there anywhere else in any other states?
So I think it depends on kind of exactly what you're talking about, because it depends on the service and it depends on the different funding streams. We're gonna go through a number of different ways to bring out different services, different professionals into these more rural areas. And so we'll touch on that a little bit. We have seen it in some communities. I don't know if it's gonna be as specific as you need, but we have the contacts to further reach out to those what's happened. So we're gonna give a little bit of background on the toolkit, which is what we put together after we collected all of this information. Talk about really these 4 primary barriers that we identified through this information gathering phase that we went into, and then leave some additional time for questions, but please feel free to jump in at any point. So when we were developing the toolkit, let me backtrack. So the Center for Juvenile Justice Reform has this amazing platform to be able to work through the Center for Coordinated Assistance to States, which is a federally funded TTA program, so providing technical assistance. It's funded through the Office of Juvenile Justice and Delinquency Prevention. And our center is partners with the American Institutes for Research and the Council of Juvenile Justice Administrators. So the 3 of us are partners on this, where we can provide technical assistance to folks who need it across the country. A couple years ago, we shifted our focus really to this rural population, which is really exciting because anybody who's worked or done any sort of research into juvenile justice, it's all focused on the cities. And for a reason. I mean, they're the hub of resources, of crime, of populations, but we have this entire country that is not all city. I grew up in a small town in Indiana where we had 2,000 folks, which sounds like it may have been a little bit bigger than some of the communities that you all are from or grew up in. But having to drive 30 minutes to get to Walmart, really exciting when we went to the mall. That was an hour away. That was a special occasion. So I get it, where you have to go quite a distance to actually get to something. And for the most part, our communities get ignored. Just because there's not that big bang for your buck when you're trying to address delinquency or crime, and it's not where most of it occurs. So it was really exciting when we got this opportunity that aligns with obviously what Administrator Ryan was sharing this morning in terms of OGJDP's priorities, in terms of how are we keeping these kids in their communities, how are we treating them as children, and how are we trying to keep them from becoming system involved. So just a little bit of a statistic here. We have about 20% of the country that resides in rural communities. So it is just a fifth, but it's a big fifth. We are an important part of this country as well. And then what we see, we had Chris Bijou, who is one of our colleagues at the center, speaking this morning about racial and ethnic disparities and how racism is very pervasive still in this country. We see those Black and brown youth. We see it all over in the juvenile justice child welfare systems, but it's exacerbated even further when you get into these rural communities. So when we sought out information for this toolkit, we leveraged a number of resources. Through the center, we've worked in a number of rural communities across the country. We reached out to state advisory groups. We were able to gather information from the Federal Advisory Committee on Juvenile Justice. And we reached out to these folks in a number of ways. First, we released, it was kind of a feedback form, if you will, where we asked folks what their biggest challenges were within their rural communities. So what were the biggest gaps that they saw in service provision? What were the biggest challenges that they faced in terms of not just juvenile justice, but with providing services to youth and family in general. Because what we really wanted to get to was not just what's happening for youth in the juvenile justice system, but how can we take a step back and pay attention to these factors that drive youth into the juvenile justice system and prevent them from getting there in the first place. So where are those gaps that we're seeing where families and youth kind of fall apart? That drives them into the juvenile justice system. So we asked about a range of different gaps and shortages that folks were seeing. We followed up with folks in listening sessions and in interviews, where we talked with them more explicitly about the different programs that they offered, the different kind of creative solutions that they came up with.
And one thing I want to add here is that really what led us to engaging in these opportunities to talk to folks, to seek feedback from them via the feedback form, to have those focus groups and those listening sessions, was that we started this endeavor thinking, okay, we're going to pull research and put together a toolkit that was more or less a literature review. Just here's everything that we know about what works in rural communities. And Victoria and I scoured libraries and we scoured Google and we went through it all. And folks, there's nothing. There's nothing. I mean, I can't even tell you, I think maybe on one hand I could count the number of studies that we found that were specific to rural communities that focused on juvenile justice involved youth. It was brutal. And Victoria and I are both academics, so that's our go-to, right? Oh, surely someone has done research on this. Well, that's not the case. And so here we are talking about 20% of the country who's literally been left out of the research, left out of the conversation. And so that was our starting place with this. It was really a rude awakening for us to realize, holy smokes, there's a huge gap here. Where is this part of the country? Why aren't we talking about this? And so this is, like I said before, really the start of the conversation. And so that was the foundation for what we're about to go into.
And so from all of that information gathering, those discussions with folks, our attempt at research, we identified really 4 primary issues or challenges that rose to the top in all of those conversations. And so the first one is transportation and distance. So actually having a method for getting from point A to B, and then also A to B being incredibly far apart. The second issue that we identified was a lack of specialized services and training. So kind of leading into, is it Randy?
Correct.
What you were referencing to a certain degree of, we can't get the right people who have this knowledge and this capacity into our area. We just lack that type of service. We lack that type of training. The third issue was a lack of pro-social opportunities for young people and also workforce development for them. And then the last one was just, in general, resource limitations. We just don't have resources for infrastructure, to provide services, that sort of thing for young people. So we're going to go into these in a little bit more detail, provide some examples from communities. Again, please jump in. And actually, I'm going to pause here. Do these align with what you all see in terms of limitations? Are there any others that you would identify?
I guess the question I have with the specialized services and training, does that also include a lack of workforce to do those specialized services?
Yep.
Okay.
Yeah. So
schools should be on there, because schools have a big impact on the community.
You know, I was gonna say, honestly, how are they identifying who needs resources and what resources they actually need?
So we focus, in our questions, we focus specifically on juvenile justice
Right.
folks, but then tangentially, we connected with folks in behavioral health realm, education realm, and the child welfare realm as well, because we know all of those things are connected. So I'm a former educator, I completely hear you on that, and we will talk a little bit about the role of schools and how they can be levied in communities.
And the education, like you said, is that terminology still out there where the school to prison pipeline is still alive?
There is.
Yep.
Okay.
Sometimes it even goes to the preschool to prison pipeline, and then we've got the foster care to prison
Because
pipeline.
the schools sometimes don't know what to do with kids, so they call law enforcement, that's
Oh,
all.
yeah.
That's correct, yep.
And that's why we need to really
Yes,
focus on it.
absolutely.
The other thing I see that I don't think is on there is that on paper, it looks like we have services, but in reality, we don't have the services. Oh, yes, this is available, but there's one person for the panhandle of Nebraska, and that's not, it's, oh, yes, we cover the whole state. No.
Yeah. It's one person, or is it really a quality service too?
Right, you get what you get.
Yeah. Any others? Yeah.
We kind of piggyback on what you just said about the panhandle example. If that one person happens to have the audacity to retire,
And replacing them takes a long time.
then the ability to replace that person takes 6 months to a year, year and a half. And actually that crosses over to virtually all professions within a rural community. The other piece I want to mention to you is it looks like from juvenile justice perspective, there is a struggle to have a forum or collaboration between the rural groups to connect and talk about how to fill in the blank. It could be where this one deputy is really great at working with kids, but the other 5 aren't. They just seem to do something else. And so then that becomes a gap.
Yeah. And actually, that's something that we kind of had in mind in some aspects as we're putting together this toolkit and collecting a hub of resources, is creating this online community of practice where folks can communicate with one another. Because everybody's operating in isolation, saying we don't have what we need. Yes, sir.
I'm in Kearney, which is the middle of the state, and I'm finding even with the branch of the university there that we don't have the students who are going into mental health professions and education that want to volunteer anymore. During COVID, everybody got paid to not work, and it's hard to turn that backward and say, get out, volunteer, get some experience. Now it's, what's in it for me? How much money can I get per hour? And Medicaid and some of the other, private insurance, and even the hourly rates aren't what they should have been, I guess, or could be, I guess. So there's some financial incentives that are lacking when it comes to incentivizing stuff. But, we can incentivize our kids to go to school and pay them gift cards and everything else that, I don't know, maybe we need to start paying our mental health professionals incentive cards too, so I'm cynical.
We'll actually talk a little bit about that. The state of Kansas has done something that will kind of go into detail. Do you all have a good relationship with Kansas? Should I not be bringing that up? I wasn't sure if there was some tension or, I'll call them another state if I need to. But no, that is such a great point, and we will definitely touch base on that. Yes.
Listen, we're talking football or basketball.
I was gonna ask about substance use, because that's so prevalent, and then that leads to juvenile justice and all of that, and it's hard to find treatment providers.
Absolutely, and again, I think it's just it's connecting the dots, right? So recognizing that juvenile justice issues are not just juvenile justice issues, right? They don't just come out of nowhere, they don't exist in isolation, and so really a lot of what we're gonna talk about, and a lot of what Victoria and I do outside of this project, is connecting those dots and getting folks to the table who work in different sectors to learn what can we do as a collective, and how can we take responsibility for our community, for our children, for our families as a collective. So we'll definitely touch base on that.
All right, so I'm gonna go ahead and jump into these specific barriers and strategies, and then also talk about some of the solutions that were identified. And I know we've mentioned this a couple times, but we intentionally looked beyond the juvenile justice system for some of these solutions, because as Alex had mentioned, those solutions in the juvenile justice realm didn't often exist. And so we were looking at creative kind of opportunities, creative solutions that could be translated into the juvenile justice system. And so this first one, as I said, is this limitation in transportation and then distance between locations. And so, we had a friend from Alaska who is sharing with us, not just, I'm thinking about my hometown and having to travel, 60 miles to get to the mall. We had our friend from Alaska saying, oh yeah, we live in these rural communities where you take a plane, a small plane, from here to here, and it travels maybe twice a day, and if you miss it, you miss it. And sometimes the weather doesn't allow those two trips to happen at all. And so we're not just talking about traveling these long distances, we're sometimes talking about traveling impossible differences. So how can you overcome those in those types of environments? Oftentimes there's a lack of public transportation. So I don't know about your all's hometowns, but we don't have a bus system where I'm from. We don't have a metro. We don't have a rail system. And so, I travel a little bit, like 15 miles northwest of my community. It's Amish country. So I guess you can grab a horse if you want to. But there's no public transportation. And so we're talking about long distances where there's no sort of supplement for folks to get from A to B. Limited private transportation, it can take forever to get a Lyft or an Uber. Our colleague, Chris, who was with us this morning, he said that he had to wait, maybe it was an hour?
It was an hour last night to get an Uber from.
He got in late, but it was an hour to get an Uber. In DC, where Georgetown is, there are Ubers all over the place. Like, you can't turn around without walking into an Uber. So it's a very different environment. And then obviously this results in all sorts of barriers to accessing services. And so there are a number of different solutions that were identified, whether they be like related to the juvenile justice system or legal system or behavioral health, mental health. And one of those options is offering mobile services. There are a number of communities that we touched base with where they had mobile legal services, where attorneys would actually pack up and they'd be able to travel to their clients, so clients wouldn't have to necessarily travel to them. There are also mental behavioral services, I think, was it in Idaho?
Idaho, yeah.
Where they offered mobile services. Yeah.
Centerpoint, we actually do mobile crisis.
Yeah, great. Yep, that's wonderful. So do you want to tell us a little bit about that?
Well, right now it's only if LPD initiates a field call, then we will go out so that it eliminates them, as you were talking, dealing with law enforcement, and they can deal with mental health people instead, and be able to access the services they need.
Yeah.
We hope to at some point build a bigger team, and obviously there's a huge need for it, but then kind of leave law enforcement out of it and just get the help they need.
Yeah, I mean, that's,
Directly, we just come to them.
that alleviates so many challenges from that it gets them the service they need directly, cuts out law enforcement, so that's working in a prevention capacity. And then also one of the things that we kept hearing in these smaller communities is that there's a stigma of everybody knows everybody. This person just walked into the mental health facility. And nobody wants to be that person that everybody knows has to go to the mental health facility. And so when you have these mobile units, you have folks stationed in different places outside of their clinic, it just opens up the opportunity for folks to feel more comfortable in accessing those services.
I was gonna say, I'd go just like this, and wouldn't even know about this, so.
Yeah. And similarly, we've had a couple communities talk about how they have offered services within schools. So Randy, you said that schools are a huge opportunity for for service provision, kind of an underutilized resource, where you can offer different types of services. We worked with a community that had probation officers come visit youth in the school in a private setting, so that, again, you aren't having kids that are having to go to the juvenile facility where there is that stigma. It's just a different environment where kids aren't comfortable, so it just opens up different opportunities. Similar to schools, we had one community that has social workers meeting their clients, so the youth and families, in libraries. So again, just changing up that environment, meeting folks in their communities, and helping to reduce that stigma and that stress of being in that kind of more formal situation.
I have one thing.
Yeah.
There are also the community school model. Have you all heard of this? Okay, so I'm seeing a lot of head nods. So a lot of places have actually utilized COVID-19 funding from the federal government to establish community schools. So you've got a school, we know that the school is so oftentimes the center of our community, and kids can go and get a haircut there, or they can get their dental work done, or it's so much more than just a school, and there is funding available for it. So things like that, where we're getting creative and it's now being recognized as an efficient strategy, not just within the community, but with the powers that be in our government. So.
One of the other solutions that we identified, and also this was greatly enhanced by COVID, but it was offering a hybrid virtual and in-person options. And this does a number of things. So one, it helps address kind of time and distance constraints. It also allows for greater exposure. So a youth could be meeting with maybe their mentor, once a week virtually, or however many times virtually, and then once a month they actually meet with them in person. And so it enhances the ability of the young person to meet with whoever that is they're meeting with, and it enhances the, whether it be a mentor, a service provider, probation officer, social worker, enhances their ability to meet with more youth more frequently. And so that kind of ties into this last one. I'll get to the public transportation in a minute, but it kind of ties into this last bullet where we're talking about adjusting caseloads to allow for traveling long distances. So ensuring that folks have a caseload that allows for them to travel across the state. Well, if you're offering both a hybrid virtual and in-person option, you maybe be able to increase your caseload rather than decrease. So there are ways to combine these different options to really make something that fits for whatever community is trying to overcome these challenges. In terms of supplementing public transportation, I'm going to talk about this a little bit more in one of the next slides where we're featuring Colorado, where they have, I'm actually going to go to it. They have this program in place called Hop, Skip, Drive, where they have hired independent folks to drive, it's almost like Lyft or Uber, but they go through intensive background investigations, and they have a number of different security measures in place to ensure that youth who are trying to get to pro-social activities, school, summer school, getting to any sort of appointments that they may have, whether they be medical or therapeutic services, getting to court hearings or community service, probation meetings. They're trying to get to all these places. They're doing so in a secure way that's being funded by the community. So this particular program is the child of kind of 12 agencies within Colorado that form this impact partnership. So they have come together to collaborate to provide all of the investigations, all of the drivers, and all of this is funded through OJDP. So they were able to secure federal funding to put together this kind of private rideshare option. And like I said, there are a number of security measures in place. These drivers have to have a certain password that the kids would know, that sort of thing. There's, like I said, background investigations. Yeah.
How long is it funded?
I actually don't know that.
That I am not sure either. We could, so there's the link here, if you want to check it out further. I've also heard of, Hop, Skip, Drive is one. We spoke to someone from Tennessee a few weeks ago, and they mentioned a program called Go Kart, which is the same, concept, but I don't know if that was a locally developed program or not. But yeah, I'm not sure which title it's under or which grant it's under through JD.
Thanks. All right, so I'm gonna pause here. So in terms of transportation, do you all have any other creative solutions or things that you've implemented within your communities that have really worked in terms of addressing these transportation and distance barriers?
Yeah, we have some kids that have optioned in to our Bancroft Rosalie School, and there's some transportation issues. We created a little transportation, so if they miss the first round, they'll come to the second round. I think the last stop is like at 9 o'clock to try to still implement getting those kids to school. We still have some issues with meeting the needs for those youth that need that transportation, so I wonder if this might be an option for those kids that just can't get on those 2-round services for that transportation system. But that's kind of like a little, we worked with the other communities to kind of help move that along, so that way families that didn't have vehicles or their vehicle were broke down, we could still try to get those kids that were missing school to school.
Yeah, that's great. And sorry, oh, no question. I mean that when we talk about kids not being able to get to school, you know, truancy is one of those direct pipelines to the juvenile justice system. And if you look at why kids are being truant, a lot of times they just can't get to school. And it's not any sort of delinquent activity; they just can't get there. So, so is that? Did you say? Sorry, that was a public school that did that?
It was, we funded it through our Madison County grant, and then, we worked, it's mostly for the youth that option to Bancroft Rosalie School, because it's mostly our trouble kids that have the need. And so we just work with, whatever we can do to accommodate those kids that were just having trouble getting to school.
Yeah, that's great.
So I just remembered one other strategy. I'm referring to notes I had jotted down actually the last time we had talked about this, because as we're kind of seeing here, there's a lot of really great ideas. And there was someone from Indiana who, so Victoria, your state, they had talked about using fleet programs at rental car companies. Has anyone heard about this? So they were actually able to, I think there was funding that was flagged through their Justice Department in Indiana, and they essentially allocate a leasing line within the budget that goes to really rental car, fleets that kind of help with that transportation as well. So again, just kind of thinking outside the box. That wasn't something that I had ever thought of or had come across, but just another strategy to potentially consider.
Any other thoughts?
Well, when you're with the kids, so one of the things I always tell the parents is that I would rather pick you up than write you a ticket, so just give me a call, so they all got my number. So I go over there and pick them up, though, I said, maybe I need to do the cash cab. I mean, right. And so they win this prize, but they hear my speech because I said, as old as I am, I still don't want to get up. Just send me a check, every morning, but whether you like it or not, it's just a practice you have to get used to. Some of us can wake right up, some of us aren't morning people, and we're all different, but when they keep hearing the same message, they start understanding it. It's always got to be about consistency, and a lot of them don't have it. Maybe somebody's saying things to them in a positive way.
Yep.
Never really say anything bad about them, but hey, let's try better tomorrow.
Yep.
That's what it's all about.
You know, that's funny. So in the work that we do a lot of different focus groups with youth who have been involved in juvenile justice, child welfare, and that's such a consistent message that we hear. It's, you know, maybe I did something wrong, but this one person who has been my mentor, is the person who builds me up, is the one that says, "Oh, we'll just do better tomorrow," and that sticks with young people for sure.
And then this year, how many of you guys have schools that send out texts on schools canceled,
Yep.
you know? I'm sending out attendance on this now. I'm gonna have like, hey, just 5 dates, get ready, come in for a meeting, let us know what's going on. So I'm turning this into a new device.
That's great. Yep. All right, so I'm gonna move into the lack of pro-social activities in a lot of these communities. So the way I like to think about this is that kids need to fill their time. Everybody needs to fill their time. And kids have a limited ability to decide how to fill their time because they just have limited capacity to, to travel. They can't drive yet, or they need permissions to go to certain places, do certain things. So how are they filling their time? And if there's not a pro-social or positive way to fill their time, guess what they're gonna do? They're gonna find some other way to fill their time. And it probably will be something that you don't want them to do or they shouldn't be doing. And so when we were talking with these different communities, we found, like I said, just a lack of activities, whether it be after school activities, clubs, sports, and not only pro-social activities, but ways for young people to really develop themselves. Did anybody go to the last session that was downstairs with the youth panel? Were there, isn't that phenomenal? That's amazing. But they were talking about they didn't have these opportunities to really figure out what they wanted to do with their lives. Well, that's a big challenge, and that's a huge ask of young people to figure out what they want to do with their lives, especially when they're in a small community where maybe they're exposed to one industry. So growing up, we had trailer factories, and they don't know what other options are available to them. So lack of positive youth development opportunities, lack of workforce development opportunities, and then obviously when they don't have these things available to them, they can engage in all sorts of behaviors that are detrimental. And so there are a number of different ways that we identified that can help fill, not only just fill their time, because that sounds very frivolous, fill their time with meaningful activities that can help them figure out what they want to do with their lives and give them the skills that they need to get there. So one of the first things that we identified were these youth development, education, and job training programs. Recently I was working with a community in Ohio, in a rural community, and the head of probation decided that he was going, for all of the youth that his department oversees, they were going to do kind of like a, not like a personality quiz, but kind of a personality quiz in terms of where they might want to go within sectors of work. So where does their personality, where do their skill sets align? And so they would take this quiz and say, okay, you seem like you are really interested in learning how to do construction, or you're really interested in doing something culinary. And then they would connect with local folks in the community to do first a job shadow, and then the kids could say, oh, no, this is not what I thought it was. Or they'd say, yeah, I'm really interested in this. And then partner with them to provide, with the local business, the local professional, to provide an apprenticeship or an internship. And that can lead into job opportunities then, either within that community or the youth could expand and go somewhere else, and then they would have those skills. So it's a very intentional networking within the community to provide these job opportunities to these young people. Also opportunities for civic engagement and leadership development. In a number of the communities where we've worked, we also encourage there to be some sort of, so when we work with juvenile justice and child welfare systems, we want youth voice at the table. So we either identify a youth advisory board, or a lot of times a youth advisory board is developed so that these youth are learning how to advocate for themselves and are able to share meaningful experiences with these folks who can make changes, and then they can help influence that change. So just providing those types of opportunities where they can be a voice at the table and they can weigh in on something that's meaningful to them. And they're living it. They've got the experience that we need to make adjustments to these systems and provide the services that they need. There are a number of volunteer programs and different outlets in communities that can be identified. I mean, this could be something like Habitat for Humanity, or even going through a local church, faith-based organizations, Humane Society. I mean, the opportunity to engage youth with volunteer opportunities is really endless. They can be developed. You can work with a local business that needs some sort of assistance where you can turn that into a volunteer opportunity for a young person to learn more about them. There's also development or identification of different after-school activities, so directly related to the school. If they don't exist, reach out to a parent who loves, his kid playing baseball. He can be the coach. It's amazing. I mean, the director of our center at Georgetown, at the Center for Juvenile Justice Reform at Georgetown, he coaches his son's baseball team and loves it. So look for those folks within the community that have those experiences or have those desires to really provide those after-school opportunities for young people. And similarly related, we heard a lot from communities about providing mentors to young people, but one of the things that folks are challenged with was we don't have anybody volunteering to be a mentor. Let's talk to the kids and see who they would want to be their mentor. Like I said, we've conducted a lot of different focus groups with young people, and I always say, we want somebody who looks like us, who understands their experiences. Ask the youth, okay, who is it that you look up to? And then connect with that person. So many times that they are flattered that they're being asked to be this youth mentor, and so they're willing to step up. Or they say, I want the right person. Let's talk to this person. And so you network and you find that person that the youth is comfortable with, and shares those important experiences. And one example of this, in terms of a program, is, has anybody heard of the Credible Messenger system or initiative? Yeah, so for those of you who did not, I saw a lot of heads nod. It is an initiative that connects youth with adults who have similar life experiences as the young person, and they're fully vetted. So you're talking about adults who've been through the juvenile justice system, maybe through the adult system as well.
Like peer support?
Yep, yeah. And like I said, they're fully vetted. Certain types of crimes obviously aren't allowed to be in the program. But it provides that really valuable perspective of somebody who's been there and knows how to get out of that situation. Is there anything that you'd add, Alex?
No, I mean, I think, one of the other things is that I think in terms of it being difficult to identify volunteers, I think this is where those connections across sectors is really helpful. So I'll talk about that a little bit more in a bit, but one example that I was gonna give later was just pairing things like a faith-based organization or a church with a mentoring program or another recreational program. They might share space, it cuts down on costs for them. They can host activities and events together, so they're getting the word out within both of their shared communities about what they do, and it's also an opportunity just to connect people to each other on a personal level. So, you may have had someone in your church who's kind of quiet, reserved, they attend one of these events, and it turns out that they actually really like working with kids, but they don't know how to go about doing it. And that's where we're able to make that connection, but you really kind of have to reach across the proverbial, I guess, aisle. I don't know if aisle is the right word, but reaching across the community, really. I think our silos are oftentimes kind of what keep us trapped. And so that's just one thing that I would add to this.
Yeah, and that makes me think, so, and we were talking about this earlier. This is such a unique community, and I know that there are others like this, but you've got the university right here to Lincoln. And so reaching out to fraternities, sororities, reaching out to different groups within the university to provide, mentoring or additional educational opportunities for young people. I mean, you've got a resource right here in the community that you can reach out to. Partnering with local businesses, having businesses sponsor young people in terms of different educational opportunities, or like Alex said, helping to provide space. Just not being afraid to reach out and network with what's happening in your local community to see what kind of resources can be leveraged. I also want to mention some kind of national level organizations that are common in a lot of communities, so like 4-H and FFA. I mean, really great resources to get you connected and to get them exposed to a wide range of things that might interest them. But here we are. Can I open this up to you all and see kind of what your experiences have been in terms of providing pro-social activities, or what's lacking, or what you've seen that has been a bit creative. Yeah.
So our community is extremely small. We live in Franklin County. 1,000 people. We're about an hour away from Kearney. And so we do not have a big enough school to have a middle school baseball team. So I drive my youngest 30 miles so that he can play baseball. And part of that is not that they don't have a coach, it's that they don't have the kids. So that is an additional situation, I guess, that we have adults that want to get involved. We just don't have the kids to actually do some of these things. So that's another thing that we struggle with in those really rural communities.
Is that about expanding the age range? Not necessarily going down and having 5-year-olds play with 13-year-olds, but maybe going up and
So
having.
they do 7, 8, and 9. So even with those 3 years, there's still not enough kids to play. So it's just a very interesting dynamic that you don't think about when you're in a bigger community.
Is it co-ed?
It is not. The girls, they have softball up until about 6th grade, and then it's just done because there's not enough at all that have enough interest.
What about in, I know team sports have such a value to them, but so do more kind of independent sports, you know, things like skateboarding or, and I know, I mean, I'm a child of the 80s and 90s, skateboarding got a bad rap back then, but I promise they're not all bad kids. But, you know, things like skateboarding where kids can do it together, but it really is independent. And so you don't need the team, you also don't need to drive 30 miles to get there. Anything could be a skate park. The cops might not like that, but it can be. But so leaning into more of those kind of independent activities, you do it with a group, but it is their own.
I think when you start, I guess when I'm thinking about this, this is probably a huge barrier because I'm listening to her talk about not enough kids. If you don't have the kids to engage in, it's hard to develop those pro-social activities. And so I'm interested in solutions to that because that is one of those things when you think about just logistically resources and funding and whatever else that needs to have happen to make something available.
When I think that too is where pro-social activities don't have to be kid to kid, right? I mean, that is great, but I think adults can also play a really vital role in that type of engagement. And then there are also things, you know, the internet can be a beautiful thing. It can be a scary place, but it can be beautiful too. And having kids connect with one another on the internet, obviously in safe ways, and even having pen pals. I mean, I remember when I was a kid, my English teacher had set up writing partners with us, with another teacher in, I think it was in Somalia, but you don't have to go outside the country. It can be another kid in a school across the state for that matter. And then you're getting skills like writing skills, we're learning, you know, about one another from a distance. So there are always, I think it just comes down to kind of getting craftier, but I definitely understand the challenge of, well, we don't have the kids here to get some of these things off the ground that would kind of facilitate a more quote-unquote typical childhood that we think of. But there are ways around that, absolutely.
Is there anybody here that had AmeriCorps in their town? AmeriCorps? No, nobody here? No, AmeriCorps. And it's a part of volunteer. You guys know AmeriCorps?
Yep.
So I'm doing truancy for 14 years, and I'm knowing court isn't changing a lot. So I wrote for AmeriCorps grant, and then a lot of people came to my community from like New York and California, brought me a lot of good ideas, and we got into community development, youth development, parenting development, because these are the things I needed to get developed so my parents would change and the kids would change. And it's out there, you guys. AmeriCorps is out there, and they can come and develop things for your community, and which is really what spurred that thing, because communities, this one lady left us on bonding, or said community bonding is essential to community development. And so that's just how you have dinner, picnics together, just things where they do as a community, and they seem to want to do things more together when they have that collaboration. So one of the things I learned, I came to the very first juvenile justice conference here, And I sat downstairs and I was about ready to go to sleep because they were showing me statistics. This guy from Michigan State was showing me 5-year and 10-year studies that he was doing for the government, showing that when kids are in trouble, you either take them out of their house and put them in detention, take them out of their house and put them in a different family's house, or leave them at home. And after all the charts, he said, did you guys notice anything different? And we're about waking up, oh, I don't know. Oh. He said, look, everything's within 5% of each other. Everything, there was no cure-all for you. And he said, I'll tell you, and this guy was old, and he said, I'll tell you what my grandma said. Now I remember, he said, if you don't keep them busy, they're gonna keep you busy. That's how simple it is. You just gotta keep our kids busy and doing things in a community. Just wanted to share that with you guys, because it still stays with me.
I think I have a purpose, honestly, just having a drive to do something. Honestly, this is gonna sound bad. I think there's too much focus on what do you wanna do? Honestly, there's so much out there. I'm 36, I really don't know what I wanna do.
Right.
I mean, honestly, I don't even know what's out there. There's still tons out there. Like giving them some kind of purpose, like I want to get at this, I want to do this. They don't have a purpose, they will not do anything.
All right, for the sake of time, we have Oregon, which part of the program that we featured in Oregon was AmeriCorps, and then also Youth Build. And so partnering locally to provide all sorts of different resources and opportunities for young people, even in terms of like civic engagement and bringing youth to like town hall and teaching them how to register to vote and then how to vote and those types of things. So a lot of really great opportunities and services that are provided to local communities, like I said, because of these grant opportunities and because of these larger organizations they were able to bring into their community. But I know that we're running short on time, so.
No, this hour is fine.
I know.
Y'all having as much fun as we are. I can see it. They're saying, Alex, you're keeping us from happy hour. So I'm gonna jump around here a little bit because we have about 8 minutes left. So the third issue that we really kind of came across was this lack of resources in communities, and that's kind of, I think, threaded through a lot of what we've heard folks here talk about today. And it's really threaded in the other challenges that Victoria went over. And so, what is this kind of linked to? Well, some of the things that we learned, well, sometimes it links to a lack of funding or a lack of awareness of what funding exists or a lack of having the capacity to get the funding. Also not knowing what our partners have available to them. And so we kind of get, we hoard our resources because we have so few rather than sharing them. And so this is where that collaborative angle really comes in. We want to break out of those silos. And so some of the strategies that we have found to be effective, and again, you kind of can mix and match these. This is not a one size fits all. This is not, these are definitely going to work. This is just things that we've come across that we're hoping will be helpful. So one, leveraging federal funds. So this isn't just OJJDP. This is looking at things like the Department of Housing and Urban Development. I know the word urban's in there, but I promise they do actually have funds earmarked for rural communities. Department of Education also has funds earmarked for rural communities, as does the Department of Health and Human Services. And it doesn't just have to be juvenile justice related, right? Think about those issues that are tangential to juvenile justice. There's a lot of funding out there that focuses on homelessness. I mean, how often have we had young people who we've encountered who have experienced some form of homelessness? And that includes couch surfing, because that really is a form of homelessness. So there are funds out there that, as long as we know what they are and how to access them, they can be wielded to the advantage of the community. But that's the thing. How do we access them? I don't have time for this. Has anybody ever written a grant for, Randy, I think you mentioned you wrote a grant before.
I had help.
It's a lot of work, right?
The state director came and helped.
Yes, it is a lot of work. So looking, across fields in terms of who can we collaborate with on this grant. We had a community in Kansas that they had their local juvenile justice agency link up with a behavioral health provider to apply for a grant within the state. So it wasn't such a heavy burden on one agency or the other, or one staff member or the other. Also looking at things online, like the Rural Community Toolbox. This is a resource that indicates different funding streams that are available for rural communities. It'll tell you where the funding stream is, how much money is within that grant package, and what different guidelines are and what the timelines are for when that grant application is due. Another thing, so community asset mapping. Who here has heard about a SWOT analysis? SWOT. Okay, so we know what that is. So strengths, weaknesses, opportunities, and threats. This is where we get folks around the table and we talk about a specific issue, and we talk about, okay, what do we have going for our advantage? What are some things that are maybe disadvantaging us? What are the opportunities that we have? And this is really where, so we had a community in Maryland, in rural Maryland, where we had folks around the table from all different departments. We had education, we had juvenile justice, we had the courts, we had behavioral health, we had child welfare. And one of the issues that came up from probation was we can't get our kids to show up to our equipments, and it's because there's a lack of transportation. They don't have money to get on the bus, and we don't have the time to be driving all over the county to get to them. And so their behavioral health department said, we can help you with that. We've actually got bus passes. But they didn't know that because they hadn't had that conversation. They hadn't reached across the aisle. So sometimes it really just is a matter of connecting with the right people. Actually, I would say oftentimes that's what it is. And it's understanding what services do you have access to that I need. And so making funding flexible, and this can come down to our state levels or even our county level departments, depending on how the state is operated. But looking at the fluidity of funding and sharing those resources. Also using data and local knowledge to inform efforts. Okay, so I know I say the word data, oftentimes people's eyes start to roll in the back of their heads. Alex, please don't talk about data. Data is boring, data is hard. I promise it's not as overwhelming as it seems. We had a community in Idaho. We worked very closely with them for a couple of years on our crossover youth practice model, and we helped them get their data off the ground. And they ended up sustaining this data collection. And so who knows what crossover youth are, that term? Okay, so for those of you who don't, crossover youth are individuals who are involved in both the child welfare and juvenile justice systems. So they collected data on this population of kiddos within this community. And they continued to collect the data, and they were able to make the case for a grant at the Idaho Department of Juvenile Corrections. And they now have a youth assessment center in their community, which helps with diversion. It helps with understanding acute needs that youth and families have. And it also assists with respite opportunities. And the reason they got it was because they had collected the data. So look at what data you have. You don't even have to reinvent the wheel. Just look at what you're already collecting, and again, partner up, and see how you can make the case for those grants that are out there, be it at the state level, through private funds, or otherwise. I'm sorry, I'm talking like an auctioneer, where you're just kind of going through it.
They actually have those around here.
All right, so the last thing I'll mention here, so we talked a lot about volunteers. This isn't just about getting kids and young people to volunteer, it's also accessing the volunteers that are out there. And so we had, I was at a detention center in Central Virginia, and they did two really cool things. So one, they had yoga instructors come into the facility and help kids with mindfulness and yoga. And they loved it. It was one of those things where I thought, oh gosh, the kids are gonna hate this. No, they loved it. They looked forward to it every week. Another thing that detention center had was a partnership with Habitat for Humanity. And so some of the kids who were there, who had been there for a very long time, they were getting ready to re-enter the community, wanted to ensure that they were equipped with the skills that they needed to be successful. And so they partnered with Habitat for Humanity. Those kids were able to leave the campus, they volunteered with Habitat, and a lot of them, when they left the detention center for good, ended up getting a job with Habitat or through Habitat and other partners that they have. Again, it's all about networking. Bless you. All right, we're gonna roll through one more slide here. Okay, and then this last slide here, the lack of lack of specialized services. So Randy, I think you had mentioned before, how do we get, and forgive me if this wasn't Randy, somebody mentioned, how do we get people to stay in our communities? How do we get those specialized services? You don't always need the specialized service in your community. Sometimes you just need access to it. So things like the hub and spoke models, which is oftentimes done in healthcare. So Vermont, with the opioid crisis up there, they established a hub and spoke sort of model where individuals who were recovering from substance use and addiction were able to kind of move in between more acute facilities and more generalized treatment. This also enables practitioners to share knowledge with each other and to have access with one another. I may not know the answer, but I know somebody who does. And so being able to pick up the phone or send an email and get that information is immensely helpful. Looking at investing in technology. So this isn't just about, okay, do we have broadband set up? Do we have, are we able to give kids tablets so that they can check in with their POs? It's also thinking from the practitioner side, what do our practitioners need? Because they're struggling too, they've got to drive these long distances. So one of the things that Kansas did was their DCF, their child welfare system, recognized that their caseworkers were struggling with getting case notes done and actually getting to appointments. So they equipped those caseworkers with dictation software. So when they were going from family visit to family visit, they were able to, in their car, dictate their case notes. Saves them time on the back end, so when they get home, they can actually go home to their own families, right? So thinking about the well-being of our practitioners and ensuring that we're not making life harder for them, but also facilitating their wanting to stay in the field. And I realize we're over and I am keeping you all from happy hour. So we do have a full toolkit and we've got the website.
If you have the Uva app, is it Uva? Is that what it's
Yeah.
The toolkit's on there. So additional resources there. We can connect you to folks if you want to reach out to us.
More than happy to.
And if you have any ideas, or if you know of other folks who are there are other challenges that you're facing, this is just the beginning. So please don't let this be the end of the conversation. Please share that information.
Thank you.
Thank you all so much.